Carlotti, how long does the whole dental implant process take?
That's a great question, and it varies from patient to patient. So let's talk about a couple of different scenarios. In a single unit implant, which means one tooth that needs to be replaced with an implant, if the patient comes in already missing that tooth, we could possibly place the implant that day and they could immediately get a temporary on it. In the scenario of us needing to do the extraction and placing the implant on the same day, I tend to hold them back from immediately temporizing the implant, meaning getting that tooth that same day. And the reason why is if you look at bone metabolism cycles, there's a dip that occurs, and you want to not have pressure on the bone when that dip occurs. So the most prudent way to assure that that implant's going to be there for many, many years would be to allow an immobilization period and allow it to osseointegrate. Depending on the implant system, that may be 4 to 10 weeks. It may be slightly longer, depending on what's referred to as the torquing strength at the time that we place the implants. Now, when you go to an entirely different scenario that's frequently flashed on our TVs these days, and they speak of teeth in a day, I think that's somewhat of a myth that needs to be debunked, in that you're not going to simply walk in and walk out with teeth. There is a teeth in the day procedure, but it takes a fair amount of meticulous homework up to that point. And when you do get that fixed denture, meaning teeth in a day, it's a temporary, and that temporary will be in place for anywhere from 4 to 6 months before it gets that final restoration. While you're in that temporary, you're on a very soft, if not a liquid diet in the first couple of weeks. So although you have a teeth, you're not functioning as somebody that never lost their teeth in a day. And I think that's an important explanation, an important point that patients understand ahead of time.